Good afternoon, everybody. Pat Zemer here with MagnaWave. I'm going to visit today with Dr. Marty Goldstein in South Salem, New York. He has the Smith Ridge Veterinary Clinic, and we have his pups with us today, so it'll be a very relaxed conversation as long as I don't get bit. But at any rate, everything's going to go fine. So he's got a little thing over here. If I say something wrong, the dog attacks. So I'm going to try to do it
You
just
behave
right.
yourself, Pat.
That's right. Dr. Marty is a best-selling author. He has the book, The Nature of Animal Healing, which we will discuss a little bit in this conversation today. So we want you just to be able to get familiar with Dr. Marty, what he does, how he integrated MagnaWave into his practice, and how it's working for him. So, but first, Dr. Marty, maybe tell us a little bit about yourself and how you became interested in holistic alternative medicine for veterinary.
I graduated Cornell in 1973. Holistic medicine did not exist. I was very into conventional medicine. I actually stayed around Cornell for a year just to learn more from the specialists at Cornell. But then I started to lose my own health. And I couldn't accept what my doctors were saying about my degenerative arthritis and bursitis, so I started a search for my own health.
And you were practicing at this time?
I was practicing,
okay.
And it led me into studying and becoming certified in acupuncture in the mid-70s, and then dietary changes. And what I saw was astounding as far as the ability to make an individual better without suppressing it with drugs. Unfortunately, it led to decades of condemnation.
Oh, yes.
But I stood by what I saw because it was the truth, and just persevered, have become tremendously accepted with the work because of documentation and making animals better and then sending back into society. So they wouldn't listen to me, but they'll listen to the proof of natural healing. And we've literally made, through my practice, Smith Ridge Veterinary Center, as you said, we've made thousands and thousands of non-responsive, hopeless, terminally ill animals better. Not just better for 3 months. Some terminal cancers, 8, 10, 12 years that had 2 or 3 months to live.
So it was your own condition that got you interested in the holistic approach,
Correct.
the alternative medicines.
Correct.
Now, do you integrate what someone would call standard practice procedures with the holistic methods, or are you pretty much 100% in the holistic realm?
No, it's integrated. We use standardized conventional medicine, unfortunately, every single day, because animals need it. So what we've done is we've screwed up healthcare so much. We've mutated it through the educational practice to disease, diagnosis, drugs, but the prevention of disease with items or elements that actually have side effects and cause disease. So when I was at Cornell for 9 years, and I never really learned anything about health. It was a focus on disease. And we've manifested that. We've manifested disease, unfortunately.
So it wasn't preventative, it was about how to deal with the disease and not how to prevent the disease.
Right. Or prevention of disease, things like vaccinations. Vaccinations don't make animals healthy. They protect an animal against a potential disease, and they themselves have probably more side effects documented than the diseases themselves. And in veterinary medicine, unfortunately, they're given every year or every 3 years. When was your last polio shot?
Oh, I was a kid.
Right. How about chickenpox? Measles?
A kid.
Right. We've unfortunately bought into the fact that animals need vaccinations regularly, even though it is now documented at the level of the university, the drug companies that make the vaccines, the AVMA, that the immunity to like a distemper vaccine is somewhere between 7 and 15 years. But we still haven't changed our accepted protocol of vaccinating as needed. We haven't changed the protocol of vaccinating every 3 years, or many vets still vaccinate every single year for all the diseases. We haven't accepted the science that proves, like us, that that's wrong. And it's harming so many animals. The unfortunateness is that in my career, from when I graduated to now, I have witnessed at least a tripling of cancer. And what used to be a disease of the old is now a disease of the young.
And what is the reason for that?
focus on disease, suppressing nature. Vaccines are immune suppressive. Unfortunately, the pet food industry has its early throwbacks into the cereal industry.
Right.
And we, once again, bought the concept that dogs and cats should only be eating, quote unquote, pet food. And many of the pet foods that have been on the market for decades are between 50 and 64% processed cereal byproducts, because it was created by the cereal industry. How much cereal does a cat eat in the wild?
Well, I was just going to say, if the cat's outside or the dog's outside, they're not eating cereal.
Exactly.
They're
Not at all. And unfortunately, the cereal complexes, the byproducts of the cereal, cause obesity, overwork the pancreas, is a basis of allergies, and those byproducts, glucose and lactate, have been scientifically proven to supply the growth of cancer cells.
I was just going to say, and the obesity and all that stuff
Right.
produces stress, which produces cancer.
Right. And then the lactate and glucose feed the cancer.
Wow.
So, I mean, it's just, once again, if we had a focus on health in creating the pet food industry, and we had scientists actually looking at what should a dog or cat eat, pet food would have not been created as we know it now. Because in nature they ate raw meat. 85-90% of their diet was meat-based with some vegetation. So if we actually looked at what should a dog, or especially a cat, the obligate carnivore, what should they eat, we wouldn't have created pet food.
Interesting. Now, the foods are available today in more of a natural state.
Absolutely.
Certainly.
The one good thing in my life is, after the perseverance of ridicule and threats and all that stuff that comes with it, the acceptance of supplementation, the awareness that vaccines don't have to be given as often as they are, the awareness, like you said, that maybe you should be feeding grain-free diets. And
Right.
the raw food industry is taking off like crazy, because that's what they did eat in nature. And especially the supplementation. We do a lot of work with supplementation, which makes up for all the deficiencies that were created through the years of degradation associated with the lack of health studies.
Very interesting. We could have a whole conversation, and perhaps we will, on this type of veterinary and how it affects and how it can be helpful to your pets and to yourself, actually, with regard to supplementation and various aspects like that. So I look quite often at MagnaWave as a supplementation. It's supplying the body with the ability to better heal itself, have better oxygenation, and that type of situation. So how did you come upon a device like MagnaWave, and how we practice, and what did you first think, and then just go there?
Well, just in general, I got exposed to MagnaWave after I've been doing this for 39 years.
Okay.
I have seen more miracles and have documented more miracles than you can imagine. I didn't think at this stage of my life and my career that I would be exposed to something that could almost change the entire concept of how I viewed medicine.
Interesting.
Or that I wouldn't get exposed to something that would make such a dramatic impact. And then, through a really dear friend of mine, the lady that actually created and directed and produced the documentary Buck,
Right.
about Buck Brannaman,
Right.
the horse whisperer, she kept on pushing for me to go to some chiropractors because they had this thing called the MagnaWave.
Right. Right.
And I trust this person immensely. I knew what she was talking about had to have some validity to it, but I was so busy. It was like, yeah, I don't need to be exposed to something else. I get exposed to 3 to 5 new things every single week. Things
Right.
like cure cancer, they're
Right.
the most amazing supplement. And after a while, you have to shut your mind to it, because you can't assimilate all of that new information and new products and be a worthwhile practitioner, because you just get confused. So finally, I said, okay, Cindy, and I went to these chiropractors'
Right.
house the day before they were leaving to do an in-depth study on MagnaWave therapy for horses down in Florida. And I got treated on the mat, and it blew my mind. And I got off the mat, my shoulder, it was the only part that was wrong, but the MagnaWave mat knew quote unquote, where my problem was.
Where you had an issue.
The person that was on the mat before me was a very healthy 27-year-old guy who had severe irritable bowel syndrome. And while he was on the mat, I was watching his abdomen go like this to a point he asked him to turn it down. Then when I got on the mat,
They hadn't changed the setting, I presume.
well, no, they turned it up more for me.
Oh, okay. All right.
And it affected only my shoulder. And I'm sitting there feeling this amazing sensation in my shoulder. And I look down, and then I look at the chiropractors, and I go, why isn't my abdomen pulsing? And she smiled and she said, because it knows. And while I was getting treated, my mind was getting blown in with the same exact mat, hooked to the same exact machine. Why was his area of pathology pulsing? And it was different than my area of pathology. So I was getting blown away.
Right.
And then my 10-minute treatment was done, and I got up and I went like this, and I said, oh my God, where did the stiffness go? What is this? So I looked at the chiropractors and I just begged them not to go to Florida the next day, because I wanted this treatment every single day.
We're back now, and again, I'm visiting with Dr. Marty Goldstein from the Smith Ridge Veterinary Clinic, and we were talking about how he got started, integrated it into his practice, the MagnaWave device. And I was telling him, beginning to tell him before we took our break, that we did very much the same thing in the horse industry. We got the device, made it horse friendly, made it user friendly, and began treating. But it became very important for me that I had to treat the owners of the horse.
Right.
So they understood what I was going to do to their horse. And when they felt better, they let me treat their horses. The real difference there was, though, that you don't treat a dog and then get on it and ride it, or a cat. But in our situation, we'd treat the horse, they'd get on the horse and ride, and they'd come back and say, "Oh my gosh, it changed leads better. It didn't fight me in the shoulders. It was just so much more responsive. It was fresher." You know, all those
Absolutely.
types of things, and they were able, and that was really exciting because they were able to experience, not only in themselves, but how well it made their horses feel.
Right.
And it was incredible. And it really worked. I mean, it grew because
It works. Everything I've ever done, why it's getting accepted now, is because it works.
So in your practice, as we were discussing, you started using it, and you're a receptionist and yourself, and you would treat some people and go, but how did you really finally integrate it and say, this is a part of our practice, and I want to make this available to you folks? Or what did you do there? How'd that flow?
That's a very important facet, because I get exposed to so many different things.
Right.
I know there are many, many things that probably work very well to promote animals' health, but I am not a researcher.
Okay.
So, especially when we see animals that have severe illnesses, it's very hard to not do what we know works so we could try something new. Well, you know,
Right.
the reason I brought my dog here is because of the reputation your clinic has in making so many animals better. Well, we're not going to use what we usually do. We want to try this new thing. And it's like, then why did I come here?
Right.
So-
Nobody wants to be the guinea pig.
Exactly. So it's hard to try something new to see if it works. One of the big criticisms that have come my way is that I haven't documented the specific effects what I do. So if we have an animal with terminal cancer that has months to live, and all of a sudden they're alive 6 years later and they're on a multifaceted program, we don't know which of those facets worked. And we're not willing to segregate them to prove which one worked. I would love to do that, but I'm a clinician and I love animals and I know I can make it better. I don't want to take an animal with a terminal illness in one of the groups and put them on a placebo.
Right.
With the MagnaWave, it was very easy because it works so quickly that you know. So it was okay, especially with my local clients, because we see clients from all over the country now in the world, is you're willing to try this new device after I use it on them and they feel a response. And if in 1 or 2 days it doesn't work, we'll go back to what we do before. So I was able to treat, especially dogs, with just the MagnaWave, no other variable, and see a response. Then when we started to add the MagnaWave in with what we were doing,
Right.
the response escalated.
Because it became very complementary.
Very, and then in my research, I got to see that scientifically proven, you have an enhanced absorption of a medicinal into an area that gets MagnaWave with tumors. So if we give injectable homeopathics or oral homeopathics or supplements, and then we MagnaWave an area, the beneficial effects of those supplements will go into that area at a more enhanced level. So it was like having your cake and eat it too,
Right.
with no side effects.
Right. So your customers were very amenable to that, and they liked the quick result.
Who doesn't?
It is. I mean, that was our deal.
Right.
We could
Who
turn
doesn't?
the horse, and it would be right now. It
Right.
would be better if it could be better. And so-
If it could, and
Right.
most can. So the blowaway of the MagnaWave for me, besides the ability to create a major positive change, is how it works so quickly, like scarily quickly. Like and especially some of the people I've treated just as friends. I have friends that come over, and they have a chronic bad back for 3 years, and 5 minutes later they get out of the chair and go, "Oh my God, I haven't felt this good in 5 years." And it's like, how can anything work that quick that's not a drug or an anesthetic?
Right, and I think I maybe just need to take a second to explain that a little bit,
Good.
so people understand that from a layman's perspective. And basically, what we're doing with the device is it is a high-powered pulsed electromagnetic device, not a low-powered. The difference between a high-powered and a low-powered magnetic device is the high-powered works faster. I mean, it's that simple. So
Penetration?
better penetration. The lower powered devices have a tendency to massage the blood cells and improve blood flow. This actually makes the cell wall or the cell membrane more permeable, allowing more oxygen in, as you're certainly aware, and toxins out. Oxygen in, toxins out, inflammation's reduced, pain is
Health is
reduced.
restored.
They can better absorb the nutrients that are available to them, and bingo, it works quickly.
Right.
And that's really it in a nutshell. When people ask me that all the time, what is it doing? Oxygen in, toxins out,
Boom.
relief. I've come to like to say or use the term, well oxygenated blood can do a lot of good.
Well, I've always said for 35 of my 40 years is that disease will exist and also create an oxygen deplete environment. So if you supply oxygen to disease, you overwhelm the disease and it goes away. And that's what happens.
Right.
You take oxygen out of an area of the body, it'll become disease, or as the disease progresses, it will deprive that area of oxygen so it self-perpetuates its own disease. That's why we've been using ozone therapy, because it's O3. And we've been using ozone for almost 30 years. And it's amazing. We've seen tumors shrink by injecting them with ozone.
Amazing.
So it's all, that's why one of the things that keeps me healthy, and I've literally not been sick in 35 years, is running. Aerobics. Air coming into the body. You feel stiff and achy, and you go out for a 5-mile run, and you're breathing and breathing and breathing. It just saturates the body with oxygen.
So, which is always
Always
good to do, is to
Correct.
better oxygen, better health, I guess would be.
It's that simple.
Right.
Nature is simple. Medicine is complex. One of the fundamentals I wrote in there is just exactly that. The medical society, the medical establishment, is probably one of the most complex practices on this planet. Nature is a lot more intelligent than man. Science, my definition of science in the medical field is man trying to find out what nature already laid down. So if you cut yourself, how does it heal? I mean, man cannot come anywhere near creating any kind of individual that can heal its own cut. As technological as we are with the iPhones and iPads and the computers and this and that, we can't replicate nature.
Right.
And that actual, the mechanism to heal a cut, for us is simple. You don't have to go to the doctor. You don't have to diagnose it. Nature heals it.
Right.
So there's simplicity.
There you go. Now let me ask you this. We have someone talking in the background, but that's okay. Maybe they can't hear. That's the way it goes. But let me ask you, can you give us some examples of cases that you have used with the MagnaWave?
Well, there's one I told you about with the potential ruptured cruciate ligament where I only treated the knee. And every time I treated that dog in the future, especially coupling it with my other things, the response was dramatic. My associate, who unfortunately left our practice to move down to Florida because he always wanted to be there and a position opened up, he had a dog with what was suspected to be what's called spinal myelopathy, which is a degeneration of the spinal cord. And this dog was almost 100% paralyzed and was losing control of bowel and urinary continence. And using the MagnaWave, he returned both bowel and urinary continence and was getting more movement in the legs. And that's considered 100% untreatable condition.
Wow.
So I'm going to be taking over that case. I'm hoping I'm going to see that case within the next 2-3 weeks, so I'll have a better understanding because he was treating it with acupuncture first, not getting much of a response. Then added the MagnaWave and started to get a response. One of the astounding things that I've seen was a little Chihuahua dog that had a very, very aggressive tumor in its thigh called a mast cell grade 3. That's like a forest fire. And it's related to the allergy complex because mast cells contain histamine. And we had that dog in with the dog's mom and my associate, whose case it was. And we went to use the MagnaWave. I was always afraid to use alternative therapies like acupuncture are typically a no-no when it comes to cancer because it throws energy and it can supply growth to the cancer cells. So a lot of these alternative practices, chiropractic, laser, veterinarians tend to veer away from it when it comes to cancer. And of course, the MagnaWave, I said, oh my God, it's just going to, if it makes cells feel this good, put it on a tumor and it's going to be that big overnight.
Right, absolutely. And
So-
there's a lot of thought to that. I mean, a lot of people think that.
I went online and started to look at scientific documentation of cancer cells with MagnaWave, and it seemed all positive. So we had this dog in, and we had the little round coil, and the owner, because the leg needed to be amputated, was willing to give this a try. So we tried to slip the coil over the leg with the tumor, and it wouldn't fit. So we put the coil on top of the tumor. We were treating, and after 4 minutes, the dog's mom screamed, "Oh my God, I think it's smaller."
Ah,
And we all looked at it and said, we agree. We took the coil and we were able to easily slip it over the tumor. So we saw a tumor shrink before our eyes. Bone tumor is the most non-responsive of all the cancers. We are now taking bone tumors, and we've had some limited response with bone tumors using intravenous vitamin C at high levels, injectable bone extracts from Germany, DMSO, high levels of vitamin A and D. Now, when we're adding the MagnaWave in and we're MagnaWaving the tumor, the dogs are responding clinically a lot quicker, and the expected growth has slowed down. So we think it's a direct effect of the MagnaWave and also an enhancement of what we're getting absorbed into the
so you
tumor.
use a lot of supplementation at the same time.
Oh yeah, we always do. We
Always
won't
do.
drop that out. We've been doing that for 40 years.
And you shouldn't.
Shouldn't, right.
I mean, that's one of the things that probably I just supplied you recently with a video, and perhaps we can work it in here into this video in the editing process of the blood flow before and after a treatment. And I mean, we do a treatment now and we treat for 10 minutes and then we take the blood again and the difference. What was amazing to me is how pre-treatment the blood cells looked like a stack of quarters and they were moving very slowly. And after the treatment, all of a sudden the blood cells are moving very smoothly, and the white blood cells were twice the size that they normally were. And there are pictures showing how the white blood cell becomes aggressive to the areas that it's attacking. I mean, just amazing to see that. And it's just that constantly, you know, it's so exciting for me to see that it will do it that fast, and for you to
see, that's the scientific evidence we need to get them to accept it. That is what I've been working with. I have a very good integrative dentist, and I treated myself after having a cracked tooth removed, after getting 2 or 3 shots of Novocaine, and he had a tough time getting one of the tooth roots out. I actually took a little piece of my jawbone with it.
Ooh.
And I had the MagnaWave there because I was treating him and his staff, just showing him. And while still on the Novocaine, I treated with the MagnaWave for 10 minutes. And when the Novocaine wore off, not only was there no pain and no inflammation, but the first time in my life, I didn't feel pain at the injection sites of the Novocaine into the nerve. So I've been working with my dentist, and David, you got to get one of these. Just the benefit you can bring to your patients. And he agreed. He said, nah, but he, just hemmed and hawed. And then he went over and studied at clinics in Europe, alternatives, where they're so much more advanced than we are.
Sure.
And almost every clinic is using this technology. And he saw live demonstrations of oxygenation of red blood cells by live cell microscopy. And he came back, he called me, he goes, Marty, you're right. And now was interested in the unit. Because he needed to see that scientific documentation.
Sure.
And when he saw the change in the red blood cells, instantly after 5 minutes of MagnaWave, he said, now I'm interested.
That's fantastic. So you're, just to maybe bring things around and wrap up a bit, your clients that come to the clinic, I've been there for a day now, and they seem very excited when they have the opportunity to make their pets feel better and to move along. How do you address that? How do you feel about that as you enter your day or enter with a new client?
I've gotten, after 40 years, good and confident in bringing forth what I know will work to make an animal feel better. It was 35 years of hell to get there. And what makes me more confident is just the documentation and the acceptance of this work at the level of the university. So it's not hard for me to sell something that is not really a sale, it's to make an animal better. And when they detect the exuberance that comes from me about the MagnaWave, it's like a no-brainer. Because it's so easy to be convincing when you know you have something at this level that not only works and works so quickly, but there's no side effects. So
that's a big issue. No side effects. Very few pacemakers and defibrillators are really about the only contraindications that are out there. Certainly there's issues with pregnant dogs, and that any doctor's going to be careful about what they do in those situations. Absolutely, right. In those situations. But you're right, no side effects. People say to me all the time, well, you say this will do everything and it's a miracle. Well, I don't want to get too excited, but I go back to the same thing. Good oxygenated blood can do a lot of stuff.
Yeah, it's almost the closest thing that I've seen to the magic bullet. I mean, it truly is. And we will still, like you said, use the other modalities, because why not? You have a MagnaWave, it doesn't mean you should eat poorly.
Right.
Just because you're going to MagnaWave yourself. No, still take care of yourself. So that's been the overview. It's an easy sell. And if you detect any resistance, and whoever brought that pet in is willing to get treated themselves, there's the sale.
Oh, they all have sore knees or sore ankles or whatever.
And I've treated so many, of my clients. And once again, like I said, the joy of having, because, the animal can't express themselves. You can see it clinically, but just to have a person stand up and go, what was that?
Yeah.
What was that?
So you wrote the book, The Nature of Animal Healing. When did you do this? And this is a revised copy.
I wrote it 1997 to 1999 with the cover story writer for Vanity Fair. It was released, I think, in June '99, and then it went to soft cover with a couple of little changes in the year 2000. I had a check because of the work I'm doing right now into society a couple of days ago on Amazon.com. They rank a little over 3 million books.
Right.
And this book has been out for 15 years and was number 6,000 out of 3 million after 15 years. And it's unheard of.
That's amazing.
It's unheard of.
So
because it should be up there between 1 and 2 million. And the reason for that is health and healing is timeless. So the fundamentals of this book are timeless. They date back to the creation of the physical body. Like I said, healing the cut.
Right.
It's there. So the fundamentals of it deals with the fundamentals of how nature heals, coupled with why does nature create disease? Is a fever bad? Is a discharge bad? Or is it nature at work? And what we need is to support that process, because on the other side of supporting a process of nature, to go through the process, is called health. Suppressing a symptom with a drug may mean feeling better, but remember, the end result of my 40 years of medicine is I witnessed cancer triple and other chronic degenerative illnesses. So there's something wrong with the way we function as an established medical society.
Amazing. So the book is The Nature of Animal Healing, the definitive holistic medicine guide to caring for your dog and your cat. You cover diet and all types of things in there.
All of it.
When you revise it again, you'll have to add some MagnaWave.
With where I'm going now with my work, it probably is going to get quickly revised. It's hardly received anything but 5-star ratings. Some of the criticisms on this book is that the source guide doesn't supply enough websites for sources. I wrote it before the age of computer.
Right.
So the Bible doesn't have websites. It's still selling like crazy. So that's one of the criticisms. So I have to update that.
Right.
And we have to update the documentation that has now come up about my comments about vaccinations and about the pet food industry, because it has changed tremendously. There are new supplementations out that we never knew about that are blowing us away, and the MagnaWave. There's no doubt. So my co-author just finished the Harry Belafonte story and is working on the Cuomo story. As soon as he's done, it's probably going to be within a couple of months, we're going to collaborate again to update this, and then book 2 is already in my head.
There you go.
Yeah.
There you go. Well, Dr. Marty, I want to thank you for taking the time to talk with me today and talk about the MagnaWave and how it works within your practice. And I just want to say that if you have any questions about the MagnaWave, potentially how to integrate it into your practice, or what you should say to your veterinarian if you want to know if they're considering something like this in their practice, please feel free to give me a call at MagnaWave. The number's on the screen, or the website's on the screen, and certainly we'll put Dr. Marty's website as well, so you can keep up with what he's doing, his podcasts, his television program that's getting ready to start. So a lot of exciting things happening. So again, thanks for staying with us today and visiting with us, and have a great MagnaWave day.